Hello, I'm Dr. Sindhu, one of treating doctor here today. May I confirm your good name and age, please? Nice to meet you, Mrs. Jamila. May I know what brings you here today? Okay. Anything else? I'm really sorry to hear about it, Mrs. Jamila, and I appreciate that you are concerned about your health. Is there anything else you would like to add? Okay. Anything else? Okay, Mrs. Jamila, understand your urgency to control these symptoms. But before we come to management part, I need to ask you a few questions in order to assess cause and severity of your symptoms. Is it okay with you? Thanks for your cooperation, Mrs. Jamila. So, Mrs. Jamila, your symptoms occur during spring season only? Okay. And so you said you have runny nose, red, watery eyes, and frequent sneezing. Do you have any allergy to animal fur and fungi? Any pet at home? Okay. And do you have any flower allergy? Any latex allergy? Do you have any itching as well? Okay. Itching in the eyes. Okay. And do you have high blood pressure? High blood sugar? Can you tell me if you are itching increased by taking bath with warm water? Okay. Mrs. Jamila, I'll ask you a few personal questions. Is it okay with you? Do you smoke? Okay, so how you cook food at home? Okay. Okay, Mrs. Jamila, can you tell me, is there any past history of asthma? Okay, if you are taking medicine for it? Do you have any skin problem? If you are taking any medicine over the counter or prescribed by a doctor, or you think that after that your condition is worsened? Okay, and can you tell me, have you noticed what triggers your symptoms? Okay, is any family history of asthma, skin problem? Okay, immediate family member are suffering from the same complaint. They have runny nose. Okay, Mrs. Jamila, you have a severe runny nose and red watering eyes and frequent sneezing, and there is personal or family history of asthma as well. Is there anything else you would like to add? Okay, Mrs. Jamila, what I have gathered from your symptoms and what I saw that you are sneezing frequently and you have runny nasal mucopurulent discharge and your nasal turbidities are swollen. Okay, and so I have come to the conclusion that most probably you are having a condition, what we call in a medical terminology seasonal allergy and allergic rhinitis. Okay, and during spring season, the condition is worsened as there are increased pollen in the air. Okay, which worsens the condition. Okay, so decrease the allergic exposure. I will encourage you to follow some lifestyle changes and some medicine. Okay, is everything clear till now? Okay, so Mrs. Jamila, what way do you want me to go first? Lifestyle changes first or medicine treatment? Okay, so let's talk about the lifestyle changes. So, Mrs. Jamila, I will encourage you to avoid going to open grassy spaces during spring season, okay, and keep door and windows of the house closed. and shut the car windows and use pollen filter for call while traveling. Okay, and I'll encourage you to wear a black sun goggles or glasses, okay, and mask when you go outside, okay. And I know you like your pet very much, Ms. Jamila, but I'll encourage you to, to be away from your cat because it might be giving you symptoms, okay, and because of that your condition may worsen. Okay, so I will encourage you to donate your cat to a friend or someone who will look after your cat. Okay. Okay, and is prescribing you nasal saline nose drops. Okay, for douching. Okay, and I'll encourage you to take steam inhalation twice a day. Okay, is everything clear till now? Should we proceed to the pharmacological management? Okay, Mrs. Jamila. So as you have an important meeting to attend tomorrow morning, so I'm offering you Azilastine anti-allergic nasal drops, okay, and just for rescue therapy, okay, and it acts fast within the 15 minutes, okay. And once your meeting is over, please try visiting me again. I might offer you non-sedating loratadine tablet 10 mg once for long-term use, okay. It will improve both eye and nose symptoms, okay. And I will prescribe you leurotonin receptor antagonist as concomitant asthma, okay. Is everything clear till now? Okay, Mrs. Jamila, if this did not work, we have other options of trying nasal drops and tablets, etc. Okay, and God forbid, if your symptoms are severe and persistent, that I may consider referring you to a special allergic clinic. Okay. Yes, because I cannot do at my clinic because they will find the allergen causing allergy and do the sensitization test. Okay, and I appreciate your concerns, Mrs. Jamila, but due to risk of sudden fainting with allergy testing is high, so it can be done only at special allergy clinics. Okay, so that's the reason I may consider referring you to a special allergy clinic. Okay, and success rate is 50 to 70%. Is everything clear till now? Is there anything else you want to discuss with me today? Okay, Mrs. Jamila, thanks for your cooperation. Here is a leaflet. It includes all the information regarding your condition. I hope it will be helpful for you. I wish you a speedy recovery. Take good care of yourself. Bye-bye.